Pharmacology nursing students, let's talk about medication administration across the lifespan. As nurses, we know that medications don't work the same for everyone. Different age groups process drugs differently due to variations in metabolism, organ function, and body composition. Let's break down the key precautions you need to take when giving medications to neonates, children, adults, and older adults. Let's start with neonates and infants around 0 to 12 months. First, we need to consider that they have an immature liver and kidneys. This means slower drug metabolism and slower excretion. They're also going to have more water and less fat, and this is going to affect drug distribution. They have an underdeveloped blood-brain barrier, which means higher risk of those central nervous system toxicity. What that means for us as nurses is we need to use weight-based dosing. We need to monitor for drug accumulation because they have that higher risk of toxicity. In specific medications like aspirin, we need to avoid because there's a risk of Ray's syndrome. We also need to think about giving liquid meds via an oral syringe and never mix in a bottle. For our pediatric patients, think 1 to 12 years old. They're going to have a faster metabolism than adults, so they may need more frequent dosing. They also have developing organs. This means different drug responses. What we need to think of as a nurse, use pediatric dosing references, not just the adult doses. Educate patients on proper dosing. Avoid household spoons and use something more specific like a syringe. Watch for paradoxical reactions. This can happen oftentimes in our children. For example, Benadryl can actually cause hyperactivity. For our adults, 18 to 65 years old, they're going to have a more stable metabolism and organ function. This means drug effects are going to be a little bit more predictable. We also need to consider lifestyle factors. Think about smoking, alcohol, pregnancy, and how this can affect medication metabolism. As nurses, we need to make sure that we're assessing for drug interactions, over-the-counter, supplements, alcohol use, etc. Consider pregnancy risk and any medications that might have a teratogenetic effect. Monitor for adherence issues. Are there issues with cost, complexity, or regimen? Our older adults are going to be 65 and older. We need to consider the fact that they might have a slower metabolism. This is going to lead to an increased drug half-life and increased risk of toxicity as well. They might have decreased kidney function, which means drugs are going to be cleared from the body slower. So watch for renal dose meds. They're going to have more fat and less water. This means fat-soluble drugs like benzodiazepines are going to last longer in these patients. And lastly, they have a higher sensitivity to central nervous system drugs. They're going to have a fall risk with sedatives and antihypertensives. Some nursing precautions here. We want to start low and go slow. Lower doses to reduce side effects. Monitor the kidney functions, BUN and creatinine before giving nephrotoxic drugs. Watch for polypharmacy. There's a higher risk of adverse drug interactions. And as with our adults, we want to assess for adherence issues, vision, dexterity, cognitive decline. Tag a fellow nursing student who needs this breakdown. And don't forget to like, save, and follow for more pharmacology for nurses.